He has received certificate of appreciation from Guinness Book of World Record in 2019 from Mumbai Smiles. Also received the President Appreciation Award multiple times at state, local levels of IDA, and being an active member of IDA since 2005, he has various posts. He has been in various posts in IDA. He's also, I'm sorry, there's some glitch, I think. Can you hear me?
Short कर देते हैं बस. I have been past president for IDA MP state, and let's start the session.
Okay.
Yes, sir.
Thank you, sir. Over to you, sir.
Yeah. Hello, any question?
It is an interactive session. So as yesterday, I have messaged each and every one of you that you have to keep your questions ready, and there is no presentation as PPT or any slides or anything. You have to ask the questions. Sir will be answering the questions or queries, or will explain with any slide or anything, pictures and all. So please ask questions. Any questions of that? Anyone has question? You can switch on mic and video both. So please ask the question. Yes, sir. As I mentioned in the FAQs, first question was if there is sensitivity while cutting the vital tooth during crown and preparation. How to take the measures not to happen that, or if it happens by mistake, or that is mandatory because of the less height and all. So how to do that? Can you please help us to solve that?
Listen, sensitivity का मतलब सबसे main reason है doing improper occlusal reduction and not following the principles of the tooth preparation. Generally in clinic, what we do is we are just rushing on to the preparation. So to avoid sensitivity, one is you should always use a new sharp burr. You should not apply excessive pressure while preparation if you are using an old burr. And third, you should always follow the anatomical contours. To make our crown prep easy, first of all, we should not cut the tooth, we should prepare the tooth. So while preparation, you should follow all the anatomical contours. And then once you are following that, there should be no over occlusal reduction. In general, matlab to make a crown more aesthetic, we lab guys are asking us to do more and more occlusal reduction or clearance, and that is the main cause of the sensitivity. So you have to be careful about your preparation, and you should only do the desired preparation. After seeing a radiograph, or pre-operative radiograph, and assessing the pulp horns and the pulp chamber dimensions, then you should follow with the crown preparation. After following these Paul principles, I think there will be minimal chances of sensitivity. Post-operative sensitivity in other cases may be because of an underlying old restoration also. So that you have to clean up recurrent caries which may get exposed while doing preparation. And third, improper luting protocols if you are following. The water powder ratio for mixing up the luting agent should be appropriately followed as per the manufacturer's instructions. And then you should always remove the excess cement so that it does not causes gingival irritation or inflammation, resulting in the sensitivity of the tooth. So these are few very simple things which you can follow and get reduction. And another, after 2-3 days, if patient is having a sensitivity problem, then it may be some occlusal interference also. So try and check and do the occlusal adjustment. That will also relieve the post-operative sensitivity of the patient. Third thing, if you are following nowadays, so nobody is using zinc phosphate cements and all. बट जिंक फॉस्फेट सीमेंट से भी जब अर्लियर डेज में ल्यूट करते हैं अपन क्राउन, तो उसमें मिक्सिंग प्रोटोकॉल हैज टू बी वेरी meticulously followed, which results in very less sensitivity. And another, in case if you are anyhow having sensitivity, so then what you can do is you can lute your permanent prosthesis temporarily with a temporary cement, and then once sensitivity subsides, then you can lute it permanently.
Okay.
Okay.
Yeah. The next question is from Dr. Pooja. When I do RCT in canine or premolar with weak tooth structure, how should I strengthen after RCT?
If you are doing
crown or composite restoration?
No. One thing we should keep in mind is for anterior teeth, after doing root canal, a crown is not compulsory unless and until it is aesthetically needed or it is very grossly destructed carious exposed tooth. So if the tooth has just become non-vital because of attrition or any other reason and you have got sufficient tooth structure, then the crown is not compulsory on that tooth. Starting from the premolar to molar, it is compulsory to give a crown after doing the root canal restoration. For example, if say premolar, if you have got grossly destructed tooth, so instead of just putting the post into the superficial 1/3 area of the tooth, which we generally do, instead that you can do a nice core built up with अपना glass ionomer restorative cements extra strength wala, or else composite, whatever is comfortable, seeing to the remaining tooth structure. A composite would be a better option if you are getting sufficient a solid tooth structure with which you can bond it, or else a glass ionomer restorative extra matlab 9, which has got extra strength, can be a better option as it bonds with a remaining tooth structure more better than composite if you are not having it. So it is not compulsory always to give a post, because in preparation of the post also you are removing lot of healthy tooth structure. So if you are doing it properly and cleaning the entire carious portion, and if you are getting sufficient tooth structure, then it would be better to do a post endodontic restoration rather than every time going in for a post. In few cases, what you can do is you can remove matlab 1 to 2 millimeter of gutta percha from the canal space and just make a small glass ionomer or a composite tag, which can act as a anti-rotational feature for your post endodontic restoration.
Okay, sir.
Okay.
Next question is from Dr. Rashi. What best we can do to keep the patient comfortable in between the appointments after crown cutting is done?
सबसे पहले तो मतलब again and again I'll be telling it, the word crown cutting is brutal. We should always tell patient that you should do a crown preparation. That sounds more better, ना? मतलब इवन टू द पेशेंट, मैं अगर पेशेंट को बोल रहा हूँ कि मैं आपका क्राउन कट करूंगा और मैं बोल रहा हूँ कि मैं आपका क्राउन प्रिपेयर करूंगा, तो इट विल मेक सेंस टू द पेशेंट. मोर बेटर एक सेकेंड चीज इंट्रा ऑपरेटिव उसके अंदर द बेस्ट वे इज मतलब इफ यू आर फॉलोइंग द प्रिंसिपल्स ऑफ द टूथ प्रिपरेशन एंड देन ऑन द सेकेंड डे इफ इट इज वाइटल टूथ you should compulsorily give a temporary with any sedative cement which calms out the dentinal sensitivity would be the best thing to make patient psychological comfort. In cases of anterior, you are giving as it is the temporary crowns more oftenly, but then they should be luted properly and they should be given matlab what you are intending to you to give in the final prosthesis. So these things will make patient more confident of you. Ki yes, my doctor will be doing a very good job at the end of the day. Hello.
Okay, okay, sir. Next question is how to overcome sensitivity in vital teeth. It is already answered. And there is one more question, how to check contacts when crown came from lab. If too tight and we adjusted in clinic, is there chances of food lodgement after 2-3 months proximity? If ये कट हो गया ना सर, तो एक और लिंक भेज दूंगा मैं, सब लोग वो ज्वाइन कर लेना प्लीज. सॉरी सर फॉर इनकन्वीनियंस.